According to the Food Allergy Research and Education Group, 15 million Americans and 1 in 13 children have some type of food allergy. Today on Being Well, registered dietitian Jennifer Hills will be in the studio to tell us more about food allergies. What are they? How are they diagnosed? And most importantly, how to manage them. We'll have that and the latest medical news coming up on Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Well, today we're talking about food allergies, and I'm so pleased that Jennifer Hills, registered dietitian from Sarah Bush Lincoln Health System, is here. Jennifer, tell us a little bit about yourself and what you do at Sarah Bush.
Well, I'm a registered dietitian at Sarah Bush, just like you said. I am an Eastern Illinois University alumni with both my bachelor's and master's degrees. I've been with Sarah Bush for 5 years now almost, and my main area of work is with adult acute care patients, but I also work as an outpatient dietitian doing counseling for diabetes, cardiovascular disease, food allergies, along with weight management and obesity.
Okay, well, and that's why we have you here. I saw through the media that you were doing a talk on food allergy, and I thought, that's a topic we haven't covered on this show, and it's something a lot of people are afflicted by.
Definitely.
Let's start by just telling us a little bit about what defines a food allergy.
A food allergy is an immunologic response to a protein in food. The body just reacts to that protein. For most of us, it's harmless, but for some patients, it does cause that reaction.
So what are some of the reactions that people will have when they ingest a food that they're allergic to?
Some of the mild reactions can be things such as just itching of the mouth or nose or ears. We might see hives or eczema. Some patients have GI issues where they'll have nausea, diarrhea, vomiting. And then we start to move into some of the more severe reactions, which can be where you start to see swelling of the tongue, the throat, and then that progresses into what we call anaphylactic shock, where the complete circulation system will shut down. It'll cause a decrease in blood pressure, and that ultimately can lead to death if it's not treated.
And those are the people that probably need to carry that EpiPen.
Yes, those are the patients that we want to carry their EpiPen and know how to use it, and to also talk to coworkers, friends, family, and instruct their family members and those that they're close to on how to use it so that they can be treated in the event that would happen.
Well, speaking of the EpiPen, I was watching TV the other night and I saw an ad for EpiPen. It was it was a mother putting her daughter on the bus, taking the EpiPen with. It seems to me, and I don't know if this is true or not, that allergies are on the increase, especially those more severe allergic reactions. Is that true?
We are seeing an increase in food allergies. Currently, we're seeing about a 50% increase from 1997 to 2011. So they are out there. Research is not telling us why there's such an increase in them. We're not really sure why we're seeing that. Professionally, I think maybe we're just better at diagnosing them. Those were patients that we just said, oh, they have a sensitive stomach. And now we're better able to put a label on that and to define what's actually going on with them.
Well, I would like you, before we go on, I want you to tell me, what's the difference? Is an allergy the same as a food intolerance? Like if you have an intolerance for lactose or gluten, is that the same thing as being allergic?
No, those are two separate things. Okay. The allergy is that immune response to the protein in food. Typically in allergy, we see onset of symptoms within minutes to just a couple hours after ingesting that food, whereas an intolerance usually is a lot more delayed, and it's typically just the GI system that's involved in the reaction unlike with the food allergy, it can be lots of different systems happening.
Okay, so we've got that part cleared up. Let's talk a little, what are some of the most common things that food allergies out there?
We call them the top 8.
Okay, top
8 food allergies that are out there. Those are milk, eggs, soy, and fish, shellfish, wheat, peanuts, and tree nuts are the top 8.
So you can have an intolerance for wheat, but you can also be allergic.
Exactly.
So clarify,
you can have there's two different systems that are at play there.
Okay, so again, how do you know if one's an intolerance or one's an allergy to wheat?
If it's an allergy to wheat, we're going to see much more of those complete system responses. We're going to see the runny nose or coughing, hives, eczema, and then on into some of the more severe things where we might start to see swelling of the throat and those kinds of things, whereas the intolerance is just really the GI discomfort, usually several hours after the food is eaten.
Okay, so can you kind of explain for us in layman's terms, like say I'm allergic to shellfish and I eat shellfish. What's happening inside my body or my cells? I guess I don't really even know, so I'm asking you.
Well, that's okay.
What's going on in our body when we take something that we're allergic to?
The food that you eat that you may be allergic to has protein in it, and when you ingest that protein, our body is creating antibodies against that protein. So every time you eat that food or ingest that food, those antibodies are released, and that's what causes the allergic reaction that we may see. Whereas a food intolerance isn't, there's not antibodies, there's not that whole system reaction that we see.
Okay, so let's start from very young children.
Sure.
If you got mothers out there that, they're not sure if their child is allergic to something, how do you go about diagnosing allergens or things that people are allergic to in young children?
In young children, typically the mom or a parent or grandparent's going to be the first one that's going to notice that there's something going on. What we typically recommend is talking to your physician first. A food diary or food log is a great way to start diagnosing those problems. If you can track into every time they drink milk, there's something that happens, or every time they eat a piece of wheat bread, something happens. That can help doctors start to see if there is some kind of trend. Typically what will happen then is the doctor will send you on to an allergist who will start to do some of that allergy testing. We see different types of allergy testing. They can test by skin prick, which is where they'll kind of make a rough area on the skin and let the protein of different food items seep in and watch for some kind of reaction to happen. We can draw blood and do blood tests to check for food allergies, and then if those are inconclusive, what they'll typically do is the food elimination. Well, they'll say eliminate that food completely from the diet, and then if the symptoms resolve, then we can pretty much be sure that that's what was causing it.
Okay.
If they're still not sure, then they can start to add back that same food to see if the reaction occurs again. And if we've eliminated it and we're still not sure, and then we start to add it back, and the reaction continues to happen, then we can know that that's probably what it is.
Okay, tell us about the connection between breastfeeding and allergies.
Breastfeeding is a nice preventative measure for food allergies. Typically, we encourage new moms to breastfeed at least the first 6 months to give that protective benefit, and then to delay adding in solid foods, rice cereal, any kind of cereal, or baby foods at least until 4 to 6 months of age.
So what if you don't breastfeed? Does that mean your children are going to get allergies?
No. It's just a protective quality that can help prevent them, but there's nothing that says that babies that are formula fed are going to develop food allergies.
So how are allergies tested in maybe older children or adults? Is it a different process for small children versus adults?
It's pretty much the same. Food allergies can happen at any age. So even those of us that have moved into adulthood, we're still at risk at times for having food allergies develop. And if an adult thinks that something has happened, then they need to talk to their physician and kind of go through those same steps to have it confirmed.
You mentioned the top 8. If you're allergic to any one of those as a child, will you ever outgrow those?
Typically, we don't see children outgrowing 4 of them, which are the fish, the shellfish, the tree nuts and the peanuts, excuse me, that we don't see those outgrown. Milk, soy, and eggs can sometimes be outgrown, usually by the age of 16. So if you're still having reactions at the age of 16, it's probably going to be a lifelong allergy. But if the reactions have decreased at that point in time, then we can safely say that they may have outgrown those allergies.
So how do you recommend for a parent if they, if their child was allergic to those, the ones that you mentioned that can be outgrown, how do you safely kind of introduce those? I mean, it sounds kind of scary to say, here, drink this milk. We'll see if you are allergic.
Yeah, let's see if you have another reaction.
How do you go about doing that?
Typically, it's under the advice of the allergist, and they will usually start introducing those things in the office.
Okay.
So that you're under medical supervision as they do that, because just in case there would still be some kind of severe reaction, you would be under medical supervision right then. I would never recommend doing it at home just on a trial basis, just in case. But under the medical supervision, they can start to add those in. Or as kids get older, they get a little more free with their diet. Mom and dad aren't controlling things as much. And they may just naturally find, oh, I used to be allergic to milk, but now I go out with my friends and I eat a cheeseburger. And I do just fine with the cheese on the cheeseburger. Maybe my allergy is not as severe as it used to be. So sometimes just over the course of being a teenager, they find out that they're not as allergic as they once were.
All right. So if you as the parent have allergies, are you going to pass that along to your children?
It's not necessarily that you will definitely pass them along. There is a stronger relation between parents that have food allergies and any other kind of allergic response. So if they have environmental allergies or some kind of skin condition like atopic dermatitis or eczema as an adult, those are things that may predetermine that your children can have food allergies.
Okay.
It's not a for sure thing, but they are risk factors for your children.
Okay. So if you suffer from seasonal allergies, like hay fever, or it's harvest season or pollen season, you get that runny nose, are you more susceptible to food allergies, or does one have nothing to do with the other?
They really don't have anything to do with each other. Seasonal allergies don't really lead to food allergies. However, we do see the reverse, that food allergies, people who have them tend to have some of those other allergic diseases that we see, like allergies to pollen and those kinds of things, and then the skin conditions. So the reverse is true, that food allergies can cause or can be linked to some of the other allergic diseases, but not that environmental allergies can cause food allergies.
Okay, it gets a little complicated.
It does get a little complicated.
All right, so when I was looking up some research for this show, I read about cross-reactivity. You need to explain that to our viewers.
Cross-reactivity, we can see that there are reactions within a single food group. For instance, if you're allergic to one tree nut, like walnuts, we may find that you are allergic to other tree nuts in that same family. But that doesn't mean that you may be allergic to peanuts per se, but something within the same tree nut family, we do see some of that happening as well.
Okay.
And the same holds true with shellfish. If you're allergic to one type of shellfish, you may be allergic to other ones as well.
So are there, speaking of fish, because my oldest sister has been allergic to fish her whole life, are there some people that are maybe only allergic to, swimming kind of fish, but not shellfish? Or
you can be.
Okay.
You can be allergic to one or the other or both combined. It just kind of depends on your body and your antibodies that you've developed over the years. But yes, she can be allergic to one and not the other. I have a coworker who's allergic to walnuts, and she just avoids all nuts, period, because she's not sure of her cross-reactivity and doesn't want to have a reaction.
Yeah.
So she just avoids them all just to be on the safe side.
So what do you do if you come in contact, maybe the first time you didn't know, maybe you never had shrimp growing up, and you out for the first time as an adult, and you go to a party and you have shrimp, and all of a sudden, what do?
You want to seek medical attention immediately. It kind of depends on the reaction that you have. You may just feel kind of funny. Some people, will feel like their throat's kind of itchy, or they'll start coughing or have a runny nose and not be really sure that that's what's happening to them. Other people, on the other hand, will have the very severe reaction with the swelling and the not being able to breathe and all of those things. And of course, at that point in time, you want to call an ambulance and head to the ER immediately to be treated.
Okay, so it's the EpiPen. Explain what that is. What does it have in it, and who really needs to carry something like that?
An EpiPen contains epinephrine, which is a hormone to combat the antibodies that are being made in the body, and it slows that response down. When someone's having difficulty breathing, the EpiPen will kind of relax all of that so that they can breathe and get through the reaction. People who have any kind of severe food allergy need to have one with them at all times. And again, anyone that works with them or is close to them needs to know where it is and how to use it. My coworker who has the walnut allergy, she says, it's in my purse and you have my permission to use it, because there's always that chance, even though she's very safe and knows exactly what she's doing, there's still that chance that she could come into contact with it and that we would need to do that for her. So it's a very important thing to have. Children at school, their teachers need to be aware, the staff at the school needs to be aware that they have the food allergy and where that EpiPen is carried, whether it be in a backpack or if they keep it in their desk, so that it can be used at any time.
And there's a certain place that it's supposed to be injected.
Yes,
EpiPen.
Typically we put it in the thighs. Is the best place to put it, and through clothes is okay. The quicker you can get it injected, the better. So typically we see it used in the upper thighs.
And why is it there versus in your arm or in your neck or something?
I think it would hurt very bad if it was in the neck. I think it's because of kind of the ratio of muscle to fat that we find in the thigh and how much it's absorbed from there. Okay,
so if you need an EpiPen, make sure you have one, and make sure though that those around you have them.
Yes.
Can there sometimes be hidden allergens in our food? Can we be allergic to food additives that maybe we don't often think of? I mean, you think of like the actual food itself, milk, shellfish.
Right.
Can you talk about that?
80% of food allergies are to those top 8 that we talked about earlier, but there are 20% of allergies that are not those top 8 things, and they can be things like food additives or just other foods in general. Knowing how to read labels, either getting education from the allergist, coming to see a registered dietitian, we can talk you through how to read the food label properly to pick up on any of those terminology that may not always clue you in that that's what it is. Not all food labels are going to say milk on them. There's going to be lots of words to describe milk. So having that education when you find out that you have a food allergy can help you to better read food labels to identify which ones are safe and which ones aren't.
So what would be some of the things that you would point out to people as common? I mean, milk, for example, how is that sometimes labeled on a food label?
You might see it labeled as lactose or some other lactose derivative or whey protein. All of those things can signal you that there's milk in that product.
Okay, so just be a smart food label reader, and if you're suffering from allergies, get some help from a registered dietitian.
Absolutely.
So what are the basic treatment options for like mild, other than just avoiding the food? Say you do ingest something and you have kind of that itchiness inside the mouth, maybe, something. How do you go about treating those?
Benadryl is probably going to be your best bet to get you through those mild symptoms. Really, the only way to prevent them is that strict avoidance of anything that food product may be in. Really, it's the avoidance, or if you have a mild symptom, something, some kind of antihistamine to kind of combat the antibodies that your body is making. Or then we go into the more extreme cases where we need to use the EpiPen and seek medical attention.
So if you do have a mild allergy and say, I don't know, you're out in the middle of nowhere with no access to Benadryl, how long can those symptoms last? Say you take a bite of something and you're allergic to it and you spit it out or whatever. How long can that sort of reaction keep going?
We can see reactions start within minutes of ingesting the food up to 1 to 2 hours after. Some research says that we can see reactions up to 72 hours after eating that food product. So it can stay with you for quite some time. So if you are out in the middle of nowhere heading towards a hospital or a clinic where there are medical professionals that can help with that, would be a good idea, just in case that immediate response or that severe response is delayed.
So if you have some mild allergies, at what point do you think someone should see their doctor? I mean, can you get through life, you're like, oh, I know I'm allergic to, peanuts. Do I need to see my doctor for that?
Not necessarily, unless you think that there's some cross-reactivity happening, and then you may want to see your doctor to get that referral to an allergist who can do more definitive treatment and more definitive diagnosis of that. And they can give you better ideas of how to treat it, how to live life with that kind of food allergy. Rather than just going, oh, well, I know I should avoid that. They're really going to drive home why it's important to do that.
I was telling you as we were walking to the studio here, when peanut allergies, I don't know how many years this, peanut allergies seemed to come out as people really started to be violently allergic to peanuts, and there was no peanuts anywhere, not on airplanes, not in schools. I told you I flew recently and they were giving away peanuts on the plane. Has peanut allergies just become more mainstream, or are we not seeing such severe reactions?
I would say it's just more mainstream at this point in time, and if you know you're allergic, then you should avoid them. And
hopefully you're not sitting next to the person on the plane eating peanuts.
Absolutely,
and you're allergic.
They just know, we're not going to cater, I guess, to those people as much, and the schools are kind of going to peanut-free zones and all of those things to protect their kids, and airlines may just not be following suit near as much as schools and those kinds of things that we're seeing.
So in these last few minutes, I'll ask you, give us some tips or advice on on managing food allergies. It's got to be challenging, especially for children. You can't watch what they eat all the time.
All the time. No.
Talk about, parents managing food allergies for their children, and then how adults we can manage our diet for food allergies.
Okay, managing food allergies is really that strict avoidance, and I know it's hard with children. I have 2 of my own at home, and you can't always, watch every minute bit of whatever they put in their mouth, but being as diligent as you can, and eliminating as much as you can out of your home, watching them when they're out in public and around other children, and just being prepared if there is a reaction to something, because it's not always going to be 100% avoidable.
Right.
Even as the most diligent parent are still going to see children with some kind of reaction at some point in time. So just being very prepared and staying very calm when that does happen. And adults, it's the same thing. We're much more able to control what we put in our mouths, and so just being aware of what's in food items, reading labels, and just being very smart about what you choose to eat is the best way to manage them.
All right, well, that was a great way to wrap things up. Jennifer, thanks for coming on Being Well and talking to us about food allergies today. We appreciate your time.
Thanks for having me.
There's nothing like a good night's sleep. But for people with obstructive sleep apnea, decent shut-eye is hard to get. They often snore and repeatedly stop breathing during the night. This not only causes daytime sleepiness, but also other health issues. More on risks of sleep apnea and what you can do about it from Mayo Clinic.
Hello. See you later. You too, Sarah. Nope, that sounds good.
As an elementary school principal, Todd Kiefer runs at top speed most of the day.
All right.
But that wasn't so easy when he struggled with symptoms of obstructive sleep apnea.
See you later, Edie.
See ya.
I was extremely tired during the day. I didn't feel like I had the stamina to keep going.
Todd hadn't had a decent night's sleep in years.
Well, I knew I had a problem because my entire family couldn't sleep.
Loud snoring, then he'd stop breathing.
And then actually a snort that would kind of all of a sudden I'd wake up.
Obstructive sleep apnea can deprive you of sound sleep and make you tired during the day. It can also cause serious health issues.
I can't help but think that's going to have some kind of impact on your health down the road.
Usually we talk about cardiovascular disease as the major problem. If you have severe untreated sleep apnea, your risk of dying from heart attack and stroke is quite a bit higher than the normal population.
Sleep specialist Dr. Joseph Kaplan says obstructive sleep apnea may also aggravate diabetes, and it may contribute to mental slowing and memory difficulties. Plus, the associated daytime sleepiness increases the likelihood of motor vehicle accidents from driving drowsy. So what do you do if you think you have it? A sleep study during which you go in for overnight monitoring can help your doctor confirm the diagnosis.
He said, you actually stopped breathing 70 times every hour.
No wonder Todd was always tired. You see, snoring happens when the back of your tongue and throat relax and restrict airflow. If you have obstructive sleep apnea, your throat relaxes to the point where it blocks breathing. A CPAP machine is a device you wear over your nose. It provides air pressure while you breathe, which keeps the back of your throat open. The device made a huge difference in Todd's life.
Because I know that in the morning, I'm going to be so much more alert.
More productive, healthier, and better able to keep up with the kids. For Medical Edge, I'm Vivian Williams.
Celebrities Tom Hanks and Halle Berry both have type 2 diabetes, and more Americans are diagnosed every year. Holly Furfer takes a look at what people can do to try to prevent diabetes or to live healthy with the disease.
Having high blood sugar, also called prediabetes, doesn't mean you're destined to develop type 2 diabetes. Making healthy lifestyle changes such as eating a balanced diet, exercising, and dropping excess weight may help prevent the disease. The American Diabetes Association says for some people at risk, taking the drug metformin may help too. In healthy people, sugar enters the bloodstream after we eat. Then the hormone insulin gets involved, helping the body's cells absorb the sugar and turn it into energy. In people with prediabetes, this process starts to work less efficiently and sugar builds up in your bloodstream. With type 2 diabetes, things worsen and people often have to be treated with insulin. If you already have diabetes, you can still make lifestyle changes to help control the disease. In people who are overweight, losing only 5 to 10% of their body weight can help improve their condition. And when it comes to food, instead of a restrictive diet, focus on cutting the fat and calories, but don't skimp on fruits, vegetables, and whole grains. For today's Health Minute, I'm Holly Furfer.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.